Imagine doing what you love, feeling free and strong, until a sudden, intense pain in your joints stops you in your tracks. For millions of people living with gout, this is an everyday reality.
So what is gout? Gout is inflammatory arthritis which has symptoms of intense pain and swelling in joints that usually begins in the lower limbs. What happens when you have gout is you have high levels of urate or uric acid built up in the body over long periods of time. Urate comes from purines, which is found in foods such as meats and alcohol. The body turns purines into uric acid during its breakdown, and normally urate is passed out of the body in urine. However, when too much is made or too little is removed, the urate builds up in the blood and as needle-shaped crystals in the joints. The areas of the body affected by gout include the joints, tendons, and kidneys. People that get gout are normally men, and they're normally middle-aged. They might have a history of gout, they might have high urate levels, and in females, they might be having menopause. The different stages of gout include hyperuricemia, which is when you have elevated levels of urate in blood over long periods of time and crystals in joint. Gout flares occur when you have periodic attacks of intense pain and swelling in joints. Tophi occurs when you have a late stage of gout, where you have crystals built up in skin or other areas of the body.
So how do we treat gout? The key to treating gout was discovered centuries ago in an unlikely source. The Colchicine autumnale is a flowering plant that was used as early as 1500 BC in ancient Egyptian medicine. The plant was used to treat familial Mediterranean fever and dermatological conditions. It wasn't until 1820 when two French chemists, Père Joseph Patelier and Joseph Baptiste Cavendish, successfully isolated colchicine, giving rise to one of the most effective treatments for gout.
Colchicine is used for prophylaxis in the treatment of gout. The anti-inflammatory properties of colchicine primarily stem from the tubulin disruption it causes. Alpha and beta tubulin are proteins that pair together and join up with other pairs to make microtubules. Microtubules are a tubular structure that are present in the cell and are involved in mitosis, cell motility, intracellular transport, and many other things. Normally, the presence of monosodium urate crystals in the joints causes the migration of neutrophils and monocytes, which are immune cells, to the joint by chemotaxis. Then they attempt to phagocytose the crystals, they rupture and release cytokines, which causes inflammation. But colchicine complexes with alpha and beta tubulin, disrupting its ability to join up with other pairs, inhibiting microtubule polymerization, which is necessary for the activation, degranulation, and migration of immune cells. Therefore, they cannot get to the site, which interrupts the cascade, decreasing inflammation. Additionally, colchicine disrupts the intracellular formation of NLRP3 into the NLRP3 inflammasome, which causes inflammation.
Although colchicine has developed quite a bit in its range of treatment and efficacy, there are still some ways it can be improved. One of the main side effects of taking this drug is gastrointestinal discomfort, including nausea, abdominal pain, bloating, and diarrhea. One improvement that can be made is to alter the delivery of the drug in a way that it only activates once it's reached the affected target cell. Additionally, because of colchicine's mechanism of action, it disrupts many cellular processes, making it a very toxic compound in high doses. If the chemical structure of colchicine was altered to increase its bioavailability, it would require a much lower dose, making it safer for clinical use.
Clinical trials have shown that colchicine effectively reduces symptoms associated with gout flares. In the first clinical study of the drug, conducted back in 1987, 2/3 of patients who received colchicine experienced faster relief of symptoms. Clinical trials have also revealed that colchicine is effective in treating other diseases such as familial Mediterranean fever and Beckett's disease. Taking colchicine was successful in prematurely stopping 75% of familial Mediterranean fever attacks. Colchicine was also effective in treating Beckett's disease by reducing symptoms such as arthritis. In recent trials, colchicine used alongside common statins lowered major adverse cardiovascular events by 31% among those with stable atherosclerosis and by 23% after recent myocardial infarction. To add, colchicine reduces CRP levels, which may contribute to its effectiveness in treating cardiovascular diseases.
Thank you so much for watching. I hope you've learned something. And don't forget to go get your colchicine now. It's scientifically proven and clinically backed. If you use the code 3104 at checkout, you'll get 20% off. Thank you.